All right, next up we have Miss Lynette. She is one of our post-surgical patients as well. Lynette?
My name is Lynette. Today, March 5th, is my 9-year anniversary of living with post-surgical hypoparathyroidism. We don't celebrate this day. I never would have imagined that a cancer diagnosis would be the easy part of my medical journey. I am a person living with a rare disease that is poorly understood by the medical professionals that we must rely on to keep us healthy. I'm an educated woman with a master's degree in special education, learning disabilities. I am a wife, a mother, a grandmother, a daughter, and a sister. I have experienced 2 different medical journeys in the past 9 years, one with the standard of care of calcium and calcitriol, the other with PTH therapies of NatPara and TransCon. Trying to navigate hypoparathyroidism with the standard of care was filled with numerous emergency room visits, constant fear of calcium crashes, constant fatigue, severe anxiety, and being hospitalized for depression. Out of these events, I learned that my body does not accept calcitriol, corticosteroids. Calcitriol causes me to have severe headaches, bone and joint pain, severe anxiety, heart palpitations, unstable calcium, panic attacks, and many days that I just did not get out of bed. My endocrinologist, a series of 5 in the past 4 years, had 0 options for me. All of them promised they could help me, but every one of them could only prescribe the standard of care, calcium and calcitriol. When they figured out that the standard of care didn't work for me, they gave up on me. I tried to explain to these endocrinologists that the side effects I was having from calcitriol. Their response was, take it anyway. And I honestly tried. I researched the brands, I looked at the ingredients, and I tried Brocatrol, Tiva, generic brands, and none of them worked for me. I had the same response to them. 3 years ago, I decided to wean myself off of calcitriol. I had to choose between my quality of life and my kidneys. I chose my quality of life, hoping that a PTH therapy would be quickly approved. My endocrinologist at the time did not believe in standing orders. So I ordered renal functional panels from an online lab company and took them to Quest so I could monitor my calcium levels as I weaned off of the calcitriol. Took me 6 months, but I did it. I was on 1.25 milligrams of calcitriol, and in 6 months I was down to 0. As a result, the panic attack stopped, the joint and bone pain went away, and the headaches ended. I had more days where I could get out of bed and function. The downside was that my body required an increased amount of calcium. I started taking calcium at 7 a.m., 9 a.m., 11 a.m., 1 p.m., 3 p.m., 5 p.m., 7 p.m., 9 p.m., 11 p.m., for a total of 18 pills, or 5,994 milligrams of calcium, or more a day. Taking my calcium perfectly every day did not guarantee that my calcium was stable. Every day was a guessing game. You never know what you're going to get. I took my levothyroxine at 3 a.m. for a total of 10 alarms daily, preventing me from getting a solid night's sleep. I felt like I was living on a tightrope, just like walking on a tightrope. One misstep and you fall. One missed dose of calcium could cause a calcium emergency. My medical journey with NatPara and TransCon is a much different story. I now feel like I am living on a boardwalk. I started taking TransCon through the EAP program on April 4th, 2023. I have not been in emergency room since January 13th, 2023. I'm able to go for walks, ride my bike again, play with my grandchildren, go to the grocery store. Basically, I can participate in life again. I am no longer a spectator. Instead of having 10 alarms set, I now have 2. One at 9 a.m. for my TransCon injection and one at 11:30 p.m. for my Tyrosint. My mental health has improved. I'm no longer battling depression. My anxiety is manageable by going for walks or doing yoga. I can look at my future with optimism.
Thank you, Lynette. Great job.